right.
National Organ Donor Day is this Friday, and Sharp Memorial Hospital is highlighting the importance of being a donor. Every donor can actually save up to 8 lives and impact dozens more. Joining us now to talk more about it here in studio is a Sharp surgeon, Dr. Marquis Hart. Good to see you, doctor. Thanks for coming by.
Happy to come.
I love the story because you were in surgery today. Tell me about it. This is kind of a nice Valentine's sweet story.
It's a beautiful story. So we had a gentleman who had end-stage renal disease and needed a kidney, and it turns out his wife was a perfect match for him. So this morning we removed the kidney from his wife, and we cooled it down to 40 degrees centigrade, and then he's in the room next to the room that I'm operating in, and we took the kidney in and placed it inside of the gentleman. Worked right away.
That's incredible. I mean, you're there, you're taking her kidney,
yes,
and then you're moving it over to him and putting it in, and
yes,
it was a success.
Yes, it was very successful.
Let's talk about, I mean, there's a perfect example of somebody helping another person. They're both alive. Right. Tell me about some of those situations. And there's the other situation where, like, for example, I'm a donor on my driver's license. Correct. And I know a lot of people kind of think about that, and they're concerned that maybe if they're in a car accident and they're in a coma, that they won't be saved because they've got all these organs that can be used for somebody else.
Yes, there are many myths surrounding organ transplantation. That's one of them. But when a patient comes in after a car accident or any illness, the primary goal for the treatment team is to save that person's life. We take an oath to first do no harm and to save the patient's life. But if we are in the situation where the patient has died, is brain dead, then a completely different team comes in to facilitate organ donation.
So what can be taken from the person? Sorry to interrupt you.
No. From a healthy individual, it can be 8 organs: 2 lungs, a heart, liver, 2 kidneys, pancreas, small intestine. And then in addition to that, cornea, you can take their soft tissue donations as well as bone and tendons. And so one person can save a number of lives and facilitate a better life for many, many people.
Is there any downside to being an organ donor in that way if you're not going to make it?
No, I don't see any downside to it. You know, the challenge is for people to communicate to each other about what their wishes are, so there's no confusion if you unfortunately find yourself in that situation. So I think the messaging we want to put out is to talk about what your wishes are with your family members, so that, let's say you didn't sign up to be a donor on your driver's license, they'll still understand what your true wishes are.
The person has to be alive but just brain dead? Is that kind of the criteria?
Well, so brain death means that you are dead. These are people who are dead, and their brain, we have tests that we can perform to understand if the brain has died or not. It's just like there's 2 types of death: cardiac death and brain death. And so these are people that would not be recovered.
Sure. So what's the message? What would you like people to take from this discussion?
Have a conversation with your family. Just let them know clearly what your intentions are if anything was to unfortunately happen down the line, so that you can save a life.
And what would be the downside of being a kidney donor? I mean, obviously you want to help somebody else, but what are the situations?
Yeah, so the other situation we're talking about are living donors.
Right.
So what we did today. So a patient may want to give a kidney to their loved one, and we screen those patients very closely, and if they're healthy, they can donate. The only thing that we have to watch for is high blood pressure in that population, but they live a normal life, and now we do the procedure robotically, so you can hardly even tell that they've had surgery.
And now this woman in your case can always tell her husband, "Hey honey, I gave you a kidney. We're watching what I want to watch."
That's right. There are some real advantages.
Real advantages. We're going for Chinese food tonight. Dr. Hart, good to see you. Appreciate it. Good. That was fun. Congratulations today. That's incredible. All right, Teresa.
All right, Dr. Hart, what a beautiful story. And as you were saying, it's like a perfect match. Thank you so much for sharing that.